Okay, good morning, everybody. How you doing? Senator Kavanaugh, do you have something you want to share with us?
I love it, too.
Oh, yeah?
Thank you, Mr. Chair and committee members. My name is Kevin Kavanaugh, representing District 16, towns of Bow, Candia, Dunbarton, Hooksett, and Manchester Wards 1, 2, and 12. Today, I'm the prime sponsor of Senate Bill 332, relative to the retention of long-term care workers and other frontline employees. This bill would establish a long-term care retention stabilization program of 2022 for services provided by frontline workers employed by certain Medicaid providers and contracted entities through the Development Services System, and is patterned after the Governor's Emergency Order number 9 of 2020. This program would provide temporary stabilization funding to help incentivize frontline workers to remain in or rejoin this critical workforce, which has powered us through this pandemic and is struggling to retain and recruit workers. The program would be set to sunset on January 1st, 2023. Deadline here. This bill proposes spending only federal ARPA dollars and directs the Commissioner of Department of Employment Security to distribute $300 per week in stipends to full-time qualifying frontline workers and $150 per week in stipends to part-time qualifying frontline workers. For the purposes of this bill, full-time is an individual working more than 30 hours, and an individual employer part-time refers to an individual working less than 30 hours. This is an effort to respond to the very real struggles of the frontline long-term care workers. According to the federal data, there are over 400,000 fewer employees of nursing and residential care facilities nationally today than there were in 2020, March of 2020. By way of reference, here in New Hampshire, the Hillsborough County Nursing Home currently has 144 open positions, and 109 of these positions are in the nursing department alone. Unfortunately, Medicaid facilities can't compete with providers that are largely funded by private insurance. Based on the discussions with long-term care provider community, the previous workforce stipend program enacted by the Governor's executive order didn't succeed to the extent they would have liked with recruitment efforts, but they were terrific retention. I do also have some copies for the committee about the dramatic drop in the frontline workers, and it's just incredible to see. And I think we can do something like this. I'm kind of surprised this bill doesn't have an FN on it, but I'm sure we could get that pretty easily with if we look at historically with the Governor's Order number 9 of who is being paid out. It's something I think we've got to try to do to help this whole group, and willing to work with the committee to change it or come up with a cap of the amount of money, or to get more information on this. So with that, I'll take any questions if I can answer.
I think you're golden.
Okay.
Okay.
All right. I have EDA, so I'm going to run if that's all right.
Okay.
Appreciate your time.
Yep, great.
Thank you.
Thank you.
You're coming over? Okay.
Let's see. Heidi Kroll. Good morning.
Good morning, Mr. Chairman and members of the committee. For the record, my name is Heidi Kroll. I work at Gallagher, Callahan, Gartrell, and I'm here today on behalf of Life Coping, which is a home and community-based care case management agency based in Nashua with a statewide footprint. They're an independent agency. They provide conflict-free case management services, which includes a comprehensive needs assessment of a patient's clinical and non-clinical needs. They develop a care plan. They help find the appropriate service providers, and they monitor the individual for any changes in their needs. I'm here in support today of SB 332, and I would like to offer a friendly amendment. I have spoken with Senator Kavanaugh about this on a couple of occasions, and I don't want to put words in his mouth, but he seems supportive of it and open to it if it's the committee's will. And so the amendment that I'm sharing with you is just to ensure that when the Department of Health and Human Services develops the program to ensure that specific providers and employees are included, it's not to exclude anybody, it's just to ensure inclusion of providers and employees that are under the 1915C waiver program. So that would be the choices for independence, the developmental disabilities, acquired brain disorder, and in-home support providers and employees. And you can see listed here the types of employees and workers that would be covered. So again, it's meant to be a friendly amendment just to ensure inclusion. My understanding is that these same individuals or types of workers were included in the emergency order that was referenced. But these, I represent the case management agencies. They are certainly frontline workers. They're doing in-person work all the time, making sure that individuals can stay in their homes and are getting the services they need to do that safely. So that, I'd be happy to take any questions.
Yeah, go ahead.
Thanks, Heidi. I don't know if you know the answer to this, but I know Senator Bradley and I talked to a constituent right after the governor did this during the pandemic, and unfortunately, this didn't cover CCRCs or assisted living facilities because they didn't take Medicaid, or they didn't have Medicaid recipients. Do you know if, does this bill allow those workers as well to receive this, or is it still just limited to the nursing facilities that take Medicaid?
I don't know the answer to that question.
I should have asked.
Yeah, I'm
Kavanaugh,
sorry, I'm
but-
not the right,
I mean, Senator
I don't
Kavanaugh.
want to venture a guess. What I would say is that the way the bill is drafted or written, it says that the Commissioner of HHS shall determine which provider types and employees qualify for the program, and then it goes on to have the language that I've shared with you and read, so it's to ensure that, as I mentioned, the waiver, the 1915C waiver programs would be included, but it's not to exclude anybody, so I think if the HHS were to, they would have the discretion, I think, to include those workers.
That's fine. Great. Thanks.
Senator Avard.
Thank you. But in your proposed amendment, it struck the language as determined by the Department of Health has been struck.
Yeah, that's just in the, thank you for that question. This is just me being a little bit of an over-editor. It's in the second, it's in Roman 2, about 4 or 5 lines down. It says the Commissioner of the Department of Health and Human Services shall determine which provider types and frontline employees qualify for this program. I didn't think it needed to be stated twice, but that's what that is.
Thank you.
Yes,
Anyone else? Thank you.
thank you very much.
Senator Clegg.
Thank you, Mr. Chairman, members of the committee. I'm here representing Granite Case Management. We're in favor of the amendment Heidi just passed out. And rather than read the whole thing, we're in support of long-term care. She points out that in addition to individuals with developmental disabilities, the continuum of care serves the frail, elderly, and adult disabled populations. We think that it should be it should include the CFI waiver providers, including case management. They were on the front lines from day one. They never left, and they're still there. And these providers deserve similar supports to their ABD, DDD, and IHS counterparts. And to the question I heard, I will ask Carolyn Virtue. She's at another meeting. I may be able to give you that answer within an hour.
Questions? Thank you very much.
Thank you, sir.
Last person signed up to speak is Theresa Rosenberger.
Thank you, Mr. Chairman. I'm Theresa Rosenberger here from Bernstein Shore, representing the New Hampshire Healthcare Association, the nursing homes. We are, I must say, appreciative of the bill and very much in support of the bill. I think you all know what we've been through the last 2 years, and any help we can get at hiring workers, retaining workers would be tremendous. I'm happy to answer any questions. At the first look at Heidi's amendment, Ms. Kroll's amendment, it looks like it's just fine. I also will say I do represent the New Hampshire Brain Injury Association, who's also very much in support of this bill, and I think would very much support Ms. Kroll's amendment as well. I'd happy to answer any questions.
Okay,
Okay, thank you.
thank you.
Before you close it, can we ask John?
Yeah, I'm just playing with this thing.
I saw you.
John, you want to answer some questions, please? All right.
Senator Bradley, good morning. For the record, John Williams, the Legislative Director for Health and Human Services.
And God of HHS. Don't put that in the minutes. My question, John, maybe, I don't know if you know the answer, but maybe you could get the answer. I think the way in line 7 and 8 that it says Medicaid funded might exclude CCRCs and assisted living facilities, but they are in the same, as we all know, they're in the same plight as the nursing homes. And so I just would put a shout out, if maybe, or a question out there, if this needs amending so that the department could consider funding them as well.
And Senator Bradley, in response to Senator Sherman's question, I think following up on Attorney Kroll's example of making sure, and also former Senator Bob Clegg's example of trying to make this more inclusive, and again, not taking a position on it, but saying that if you want to ensure that that would be included, I think you would want to make a reference to that within this, within the bill. On the other hand, certainly flexibility is very helpful to us, and sometimes keeping things more wider might be more helpful for the department to make those decisions as to which frontline providers should in fact qualify for this very important additional payment for their contributions. And so with that, that concludes my testimony. I can certainly take back to Associate Commissioner Chris Antonello. This would be in her world. And also I was expecting perhaps a conversation between our agency and with Deputy Commissioner Rich Lavers from the New Hampshire Employment Security, because certainly we would be managing this program with the two agencies respectively working hand in hand.
Further?
If we were to come up with an amendment that made it more inclusive, rather than listing every potential recipient, it might be better to just take out anything that excludes recipients and then have it. So maybe you could think about that and work with Chris.
I would certainly agree with that approach, that would be a much better approach versus trying to create the slippery slope of a list, because then it becomes by nature more restrictive in terms of our ability to manage this program.
Okay. Yeah, but I think, let me ask my questions first. So I'm really kind of struck by the fact that there's no fiscal note. Do you have anything to illuminate my being struck?
Senator Bradley, we're struck on the same occasion by the fact that we were not requested, nor to my knowledge was the Employment Security requested to doing some type of a financial analysis. I think because of the reference to the ARPA funds, it might have been a decision, I'm just speculating, that they decided there wouldn't be a general fund impact associated with this, but certainly it'd be helpful for us as an agency to be able to report back to what we see as resource demands. Even though this is time limited, it's for the first half of state fiscal year 23, so it would run from July 1st to July 1st of 2022 to January 1st of 2023. At least that's what the language here has relative to the repeal of this particular program. But it would require some resources by both our agency and Employment Security. Again, I'm sure that we would be happy to provide additional information working with that other agency
So it would seem to me that given that we had a $300 stipend in 2020, that this calculation would be done fairly easily.
And that was my initial understanding of the read of this legislation, which it is, obviously a very important piece of legislation, that we would mirror what we did existing during the, when we were under the emergency order during that same time period. We'd replicate that rather than reinventing the wheel.
I guess this is a question to you, but maybe anybody else who can answer it can answer it. What was the cost of the stipend program that was developed under the emergency order? I thought it was in the range of $30 million.
And I would have to defer to somebody else, perhaps somebody else in the audience would have that figure.
Okay. So consider it a request from the committee to come up with a cost estimate. I think the cost of the 2020 program, the length of its duration, the number of people, we'd want to see the same number of people potentially covered under this bill and the cost of this bill, and obviously the source of funds. But, as we've talked about in several different bills, one of which I had introduced to dedicate ARPA funding, that process has not generally gone through legislation. It's gone through the fiscal committee. But before we do whatever we're going to do, I think knowing the cost would be helpful. So you have 2 weeks.
Senator Bradley, thank you. I will follow up with our
But actually, it'd be probably helpful to email it to everybody, during the break, okay? But we'll have to, well, this bill doesn't have an FN, but I think in fairness to the Finance Committee, it's gonna have to go to Finance. Senator Gray.
I'm going to direct this question to you, but I think that others, $300 full-time at 30 hours, $10 an hour, looks a little bit high to me, but what happens in January? Stipend stops. I've tried to retain employees. They get a $10 an hour cut.
I think that's a rhetorical question.
and I would believe. So unless there's somebody who can do the math fairly quickly in the audience, thank you so much, Senator Bradley. Thank you.
Okey doke. Is there anyone else who wishes to speak on Senate Bill 332? All right, seeing none, we will close the hearing. I managed to walk across the street without my bill folder, so give me a moment to organize myself. Here you go, Cam. Yeah, I mean, no estimate what it's gonna cost. No. Thank you, though. My own fault. You ready? Okay, we will open the hearing on Senate Bill 335 and recognize Senator Prentice. Good morning.
Good morning, Senator Bradley and members of the Senate Health and Human Services Committee. For the record, my name is Suzanne Prentice. I am the state senator from District 5, proudly representing Lebanon, Hanover, Claremont, Lyme, Canaan, Enfield, Plainfield, Cornish, and Charlestown. I'm here today to introduce Senate Bill 335. The New Hampshire Health Systems Pharmacists and Dartmouth Hitchcock have asked me to bring this bill forward. SB 335 is making one simple change to the statute that governs collaborative practice agreements held between pharmacists and prescribing providers. Senate Bill 335 is removing an unnecessary patient action step from the mode of healthcare delivery while not removing consent. That takes place at the time when treatment begins. The care begins between the practicing provider and the patient. We do have Marilyn Hill here today, who is an ambulatory pharmacy manager at Dartmouth Hitchcock. She's here to testify on behalf of the New Hampshire Health Systems Pharmacists in favor of this bill, and she'll be able to answer any questions that you might have. Just a few quick items that I'd like to share with you is that collaborative pharmacy practice agreements are formal. They're a contract between a practitioner and a prescribing authority and a pharmacist, and this is pursuant to RSA 318-16-A. This agreement authorizes the pharmacist to provide specific patient care services. A collaborative pharmacy agreement may include single or multiple practitioners and may include single or multiple pharmacists. What 335 does is it amends RSA 318:1 to remove the requirement of a patient's signature on the collaborative pharmacy practice agreement. This change in statute streamlines the delivery of care provided to patients who are benefiting from these collaborative practice agreements between a practitioner and a pharmacist. What Senate Bill 335 does not change is informed consent requirements required by federal and state law and rule. It does not change the scope of practice for a licensed pharmacist pursuant to RSA 318. It does not change the scope of practice for licensed advanced nurse practitioners pursuant to RSA 326B, or the scope of practice for a licensed physician pursuant to RSA 329A. I'm pleased to report that there's a group of stakeholders who've been working on this diligently, and they include, but are not limited to, the New Hampshire Society of Health System Pharmacists, the New Hampshire Pharmacists Association, and the New Hampshire Hospital Association. So with that, I'll conclude my introductions. I'm happy to take questions, but if I don't have the answer, I have the experts behind me who can help you out with your questions. So thank you very much.
That's the way I would handle it. Very brilliant on your part. So seeing that there are no questions of Senator Prentice, I really don't think there are. Thank you. And I would just note that no one signed up in opposition to the bill. So, Ms. Hill.
Okay, thank you,
Yeah.
Senator Bradley.
You're welcome.
Chairman Bradley and members of the committee, my name is Marilyn Hill. I am the ambulatory pharmacy manager that Senator Prentice just alluded to. I'm here to support SB 335 on behalf of the New Hampshire Society of Health System Pharmacists. My points very much echo what Senator Prentice just mentioned, so this is an administrative cleanup bill. It's meant to increase patient access and decrease some clerical burdens that currently plague our pharmacists when delivering care to patients across our state. Like she mentioned, this does not affect informed consent laws relative to healthcare. It is just the collaborative practice agreement, which is a pretty lengthy document that is between the attending provider and the pharmacist. And everything else is written out for you, but I'd definitely open it up for any questions you might have.
Wow. You wowed us. Thank you.
All right. Wonderful.
Is there anybody else that wishes to speak? Beth or Paula or Dr. Fang? Everybody signed up. Everybody's in favor. Okay, let us close the hearing. All right, so question. We certainly can exec this bill, and there may be a couple of others. I do think we should have a discussion on each and every bill that's still in front of us, get updates, but I don't want to do it without Senator Sherman here. So, do we want to recess for 10 minutes? And is somebody going to contact Senator Sherman to see, because he told me that he had to participate in an EDNA exec session.
Thank you, Senator Prentice. Your bill is safe here.
Thank you.
You wowed us.
All right, why don't we, you want to call Tom and get an idea how long he thinks it'll take? Sure. And then we'll be in recess for 2 minutes. the recess being over, we're back in session. Senator Avard has moved executive session. All in favor, say aye. Aye. All right, so we're gonna take up the bill that we just had the public hearing on because there have been some more questions on it. So we're going to recognize again Ms. Hill and potentially Ms. Sargent. Senator Gray.
Okay, well, what I'm trying to understand is what the existing law is, so that when I scratch out the patient having to sign, I know what I'm doing.
Yes, so collaborative pharmacy practice is currently defined as the attending practitioner who is seeing the patient refers to the pharmacist. With this agreement in place, the pharmacist can initiate, modify, or discontinue medications outlined in this legal and clinical agreement. So operationally, that means that you're seeing your PCP for diabetes, they try a couple different things, they then refer you to the pharmacist. The pharmacist can continue the medication changes in a frequency that might be a little bit closer, higher frequency, because patients might need a little bit more attention. They're able to do that by themselves in collaboration with the physician or provider on record. So they don't need to go back and ask, hey, are you cool with this change? Because it's all evidence-based and outlined in the agreement.
That's current law.
That's current law.
The collaborative agreement.
It sure is.
Okay.
So this is removing the signature piece on that technical legal document that the pharmacist uses to help guide their decisions, which can be like a 15 or 20-page document, which is often pretty confusing for patients because we're asking them to sign something else on top of the stuff they've already signed to initiate treatment with their provider at the beginning, which is pretty confusing.
But that signature at least means that there has been the conversation that the pharmacist now is going to be directing part of their care and not the doctor that prescribed the medication to begin with.
That is true. But I would argue that that is regular good bedside manner and doesn't need to be outlined in statute. The patient can always refuse services if they do not want to be cared by the pharmacist. And with other auxiliary personnel, PT, OT, other people in clinic, you're not going to sign an additional legal agreement to start care with them after your physician has referred.
All right, now we're having all sorts of questions.
No.
Senator Sherman, then Senator Avard.
I was just going to say what you just said. When we don't ask for consent when we work with PT, OT, or even other physician or provider consultants. So as long as it's in that team approach, we don't get a separate consent for each person to see you in that.
Team approach, meaning the physician,
Right.
physician assistant.
So
whatever.
either in an office setting where the pharmacist is embedded in the office, in the hospital setting where the pharmacist is a part of the hospital collaboration. The other one that's a really great example that I like to use is management of heparin and anticoagulation, because there you're going to be following lab testing, or gentamicin, you're going to be looking at peak and trough levels for vancomycin. All of this, pharmacists actually are hugely value added, and for them to come back for a new prescription every single time this is why we've moved forward with collaborative care a few years ago. But it's the only one where we actually require consent for ongoing care. Nowhere else, unless you're going for a procedure or something like that that actually has heightened risk, the pharmacist actually decreases the risk. So it's just, this bill just brings it back into the standard of practice for every other part of the team. And that's why this is recommended.
Yes, I would agree with that. Thank you for explaining that.
Probably just for a sec.
Senator Avard,
I'm good, thanks.
Senator Whitley. Good, thank you. Senator Gray, more questions?
I have lots of questions,
Go ahead.
but I'm not going to ask any right now.
I'd be happy to connect with you offline too. I think pharmacists in general, we have a confusing scope of practice, right? We are sometimes within the walls of the pharmacy, but we are equipped to help patients outside of that. And I'd love to facilitate any additional understanding on that topic offline.
do you want to add anything, maybe answer any questions?
Good morning, Chairman Bradley, members of the committee. My name is Beth Sargent. I work for Champaign Capital Group, here today representing the New Hampshire Society of Health System Pharmacists. So I think the easiest way that I understand this is what happens with a collaborative practice agreement. It's an agreement between the pharmacist, the doctor, and the patient. So I think the easiest way for me is a diabetes management example. So the doctor says, hey, this patient needs to be monitored a couple times a week or more frequently than coming into the office and paying for the copay there. So the document itself, the collaborative practice agreement, outlines the parameters by which the pharmacists act under. He says, here, you can raise or lower the levels of different medications within this agreement. So that technical agreement is what, when the legislature signed this, is what the patient has to sign. What's happening in the hospital setting is that is confusing the patient when they see that 20-page technical document about the change in med levels. Is that good? Yeah. Okay. So by removing the signature, Senator Sherman is right. When you go to PT, you have your informed consent with your PT. With your primary care. When you go to physical therapy, they don't ask you to do another informed consent. So it's an agreement whereby the doctor and the pharmacist, it's really between those two on medication levels and the scope the pharmacist is allowed to work on. I would also add that pharmacists go here in New Hampshire to Mass College of Pharmacy. We have a 6-year PharmD degree. So they are working, this is within their scope of practice that they're trained for the 6-year degree. So so those are the pieces I'm trying to answer your question. Is that helpful?
The part I guess I'm struggling with is understanding existing law.
Mm-hmm.
And I'm, if a physician could say, your blood thinner,
Mm-hmm.
Within prescribed limits,
Mm-hmm.
and as monitored by lab work,
Mm-hmm.
okay?
Yep.
And that lab work would get reported both to the pharmacist and to the doctor, and I don't know why it would need this agreement to do that in the first place, but that's existing law, okay?
Yes.
And would change. Right now, the part I'm struggling with is taking the patient out of a decision when they could be the one that's selecting the pharmacy or pharmacist
Mm-hmm.
in the first place, or am I saying, well, because this physician has an agreement with this pharmacist or pharmacy,
Mm-hmm.
that now I'm restricting their ability to choose? Again, it just,
I think the answer to that is the physician is going to have that conversation with the patient and say, hey, I'd like you to be monitored a little bit more often. So by us entering into this agreement, I'm telling the pharmacist, you can work within these parameters. And you're going to correct me if I'm wrong. So in that document, the doctor tells the pharmacist, here, within these levels, you can move up and down if the patient needs it this week. You're seeing them. The physician is trying to get the patient better care so that we have better outcomes, so they don't wind up in the emergency room. But when the physician has that conversation with the patient, if the patient doesn't agree, they don't have to go to the pharmacist. I think it's a conversation they have about, hey, I have this idea about some better health outcomes. And in the hospital setting right now, they are part of the team. The pharmacist I know in surgeries, they are part of the team. So they come down in the morning, they talk to you about your meds, talk to you about your anesthesia. So in a hospital setting, the pharmacist is part of the team already. So a patient would be familiar with that.
and when I check into a hospital,
Mm-hmm.
the hospital rules say that I'm not gonna go get meds outside of the hospital and bring them back in. So I've accepted that, but
Mm-hmm.
now if I'm an outpatient, you're directing me to a particular pharmacy. Again, the bill takes the person out. It says behind the scenes, that we're going to have this agreement. And it's taken away my choice of pharmacies, it's taken away a lot of things when,
Well, I
again,
think
I'm
it's just,
just
oh,
not
do you want to try?
comfortable with it.
All right. Excuse me.
You can sit with me.
Hold on.
Say it
Courtney will
together.
try.
Hi, Senator Gray. Courtney Tanner, Director of Government Relations at Dartmouth-Hitchcock. So I just want to separate a couple of pieces that I think are being conflated. I think retail pharmacy and patient choice are important concepts, but they're different from a collaborative practice agreement. There are only a handful of collaborative practice agreements here in the state of New Hampshire. 49 of our states have made collaborative practice agreements legal and have collaborative practice agreements in the nation. Collaborative practice agreements, as Senator Sherman pointed out, are for severe and chronic disease management. And so we're not really thinking about patient choice when we're talking about collaborative practice agreements. Collaborative practice agreements are pharmacist and clinician partnerships that have a lot of administrative work that go behind them. They are protocols that, they're documents that specifically outline protocols, as Beth said, that articulate different changes in medications. They're overseen, as to Marilyn's headbanging, over by our legal counsel, who makes sure they're in compliance with CMS. They're really specific documents that really are only going to be used for complex disease management and for patients who have chronic diseases. Not so much for the retail pharmacy that you might have experience interacting with. So patient choice is not so much on the table for this bill. Senator
So,
Bradley.
Let me jump in here, too.
Sure.
These collaborative agreements seem to be for a patient that's in a hospital setting receiving drugs, as opposed to the patient who is prescribed a drug that then goes to Walgreens or Rite Aid to fill that prescription. So there's not a collaborative agreement there. Is that correct?
Well, you know my role. I'm speaking for
You're
Dartmouth-Hitchcock, so yes,
Right.
that's been my experience. I'm not going to speak for CVS or other retail pharmacies.
Maybe Senator Sherman, being the only doctor in the room, can
Well, just to follow up first, and so Dr. Sherman can, there are things that we talked about, blood thinners, okay? Blood thinners seem to me that it may be something that you would be on because expected blood clot in your legs or whatever, and that might be done as an outpatient, not an inpatient thing. And the collaborative agreement would or wouldn't, I don't know, be in effect at that time. And I'm sure that there's other things like that could affect it. So I'll let whoever comment on whatever part.
Senator Gray, I think you've hit the nail on the head. I think, in fact, most of our collaborative practice agreements, we want to have in an outpatient setting so that patients can be managing their disease state, while they're at home, so we can get them out of the hospital, which is a much more appropriate setting for most patients. So I think you've hit the nail on the head. Most of these collaborative practice agreements will actually happen in an outpatient clinical setting, as opposed to an inpatient in-hospital setting.
But then that's where I go back to, now I've limited my choice in places that I can go and get this medication that I need, because the doctor would have to have already had an agreement signed with them, and the patient now, with this change, wouldn't get a choice.
No, is the short answer. Just like any consultant, I don't get, when somebody sends somebody to me as a gastroenterologist, the patient can choose to come to me or go to Atlantic Digestive Diseases. They don't have to come to me. The doctor says, I want to refer you. But when they do come to me, we don't have them sign consent to come see me. That's not done. It is their choice who they see. So in a collaborative practice agreement, my understanding is that the doctor is working with the pharmacist, who's a collaborative practice pharmacist, in making sure the medications are correct. It's a higher standard of care, but in no other setting would person helping the doctor require consent? Does that mean that the patient could say, because the doctor is going to say, you know, I'm working with our collaborative practice pharmacist here in the office, and the patient could say, well, I don't want you to work with that one, I want you to work with another one. Of course, they have that right. Probably not great for their care, but they would have that right.
Yep.
But we don't require consent for every consultant that a patient sees. In fact,
Well, we do, yeah, patient consent is not changing with this. This would be, you know, if someone's at Dartmouth-Hitchcock and they're inpatient, and they're about to receive some physical therapy or some other outpatient services when the post-discharge, we don't require patients to sign an MOU between provider and provider. That's what this change is doing. It's not changing informed consent. It's actually not changing patient's choice in their treatment either. Marilyn, did you want to?
Yeah, I just wanted to add something real quick. Senator Gray, I think a lot of your questions might be stemming from the fact that the pharmacist is traditionally seen inside the pharmacy, right? They're dispensing drugs, they're educating people when they pick up their medication. Collaborative pharmacy practice is designed, it can be used in that setting, but primarily it's used in a health system or like a clinical setting where there is a PCP, an attending provider. There are a bunch of other auxiliary staff underneath them, which includes the pharmacist. So this person is seeing patients in the office. They are not dispensing drugs. They are sending medications where they need to go in the same way that a PA or an APRN or even the physician would be doing for the patient. They can send it to any pharmacy that the patient would like. They are just adjusting therapies to get their current chronic disease state under control, which I think is confusing if you haven't experienced it firsthand. Hopefully that's helpful.
So the delineation is that this is a clinical pharmacist, not a dispensing pharmacist. So the clinical pharmacist is the one who might be working with CVS or Rite Aid or whoever's, to make sure that they're not working for them. They're just tailoring the medications, looking at the lab results along with the primary care or the other provider, but they are not the one dispensing.
Correct. They could be. It hasn't been picked up in the retail setting as often,
Right.
but yeah. Hope that was helpful.
All right. Are we good with the questions? Have you been recording this part? Okay. All right, I know it's a little bit unusual, but I think that for purposes of the hearing report, if you can incorporate, is everybody all right with that? It's a little unusual, but I think it would better preserve the record of some of the questions that Senator Gray and Senator Sherman have asked, as long as you can do that. Okay.
Can I just make a suggestion?
Yes.
If Senator Gray is still uncomfortable with this, I could see an amendment that might exempt the consent requirement in settings like the hospital or an outpatient setting where the pharmacist is embedded in it. Just if that would make him more comfortable, but I think it becomes really burdensome if you have to have consent every time a pharmacist is engaged on a clinical level. It's sort of the continuum of care.
Especially in COVID times where telehealth is a mainstay, right? Getting signatures
Right.
that way is really challenging.
Okay. Great. Okay, are you here now, or
I'm here
are you gonna have to
until-
go to ED&A?
I'm gonna have to go to the ED.
All right, well, let's,
We could do.
we're
Senator
in
Abart's
executive
bill.
session.
I like this bill.
I do too.
Senator Gray, do you want to work on this bill 335 with Senator Sherman on an amendment, or are you good as it is now?
I'm willing to support the bill for right now if my conversations with either Senator Sherman or others make a floor amendment possible.
Necessary.
Then, yeah, if it's on consent, I could pull it off. But again, there has to be a certain level of trust in the people that, come here. So I'm willing to support it now. I understand in a clinical setting where, I go in that this agreement would be unnecessary. I'm just on an outpatient basis where, I'm trying to get the right level of blood thinner for whatever reason, that I think that you could do this kind of a thing, but it may not, it may be the way that the physician can write the prescription to begin with, that the level of heparin can be adjusted based on whatever, but I don't think that a physician can write that right now, so, yes, I'm willing to support it right now, and I will do further investigation.
I motion ought to pass.
All
Second.
right, so Senator Avard has moved ought to pass. It's been seconded by Senator Whitley. Is there any further discussion? Seeing none, all in favor, say aye.
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 Opposed? All right, Senator Sherman's gonna take it out. It's not going on consent in the event that there may be a floor amendment. We have 2 weeks, so, Senator Gray, if you wanna continue your discussions with Senator Sherman, that would be good.
Mr. Chair, we have an amendment for my Bill 390.
Yep.
Actually, it was Senator Sherman.
While Senator Sherman is here, why don't we take that one up?
And he's the one who actually worked with interested parties on this. For some reason, my name's on it. It's actually Senator Sherman's, his work. And
Can we get Paul and Kyle to come up?
Sure.
Paula and Kyle, if you guys would come up just to make sure, walk through what we talked about on the amendment.
Do you need an OTP motion on the bill? Talk about the amendment.
So,
off?
I'm off.
Oh, okay.
Sure, so I can walk through the amendment. So we went back and chatted with Paula on some possible language that could address any of the concerns that came up during the public hearing. The main change, there's 2 changes. The first one, right at the top of the bill, section 2, paragraph 7, just clarifies that nothing in this section shall limit a provider's ability to determine the diagnosis, consultation, or treatment for an individual patient. Similar to a traditional provider's office, it keeps the provider into control of what type of care. And then the second change is around consent and standard of cares. It is farther down on the first page. It starts on line 11, clarifying that the use of telemedicine, as long as the practitioner verifies the identity of the patient receiving health care through telemedicine, discloses to the patient the healthcare practitioner's name and contact information, the type of health occupation license held by the healthcare practitioner, obtains oral written consent from the patient or from the patient's parent or guardian, and meets the standard of care. That's something that's obviously fairly standard in any practitioner's office, but we just thought it would be important to clarify it in the bill to add a little bit more guide rails onto folks that are choosing to use asynchronous telemedicine. So, and then that section just gets repeated into another part of statute on the second page of the amendment. So those are the changes.
And we appreciate and support these changes. This addresses our concerns, and I do appreciate Kyle and crew working on this with us. And so I'm fine with this.
Yeah, go ahead.
So I'll move ought to pass.
All right, Senator Sherman has moved ought to pass. Well, now we have to have a motion on the amendment.
Move ought to pass on amendment 0788S.
Second?
All right, is there any further discussion on that amendment? favor, say aye.
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 Any opposed? Okay.
Move on
Is
to
there a
pass.
subsequent motion of ought to pass as amended?
So moved.
Moved by Senator Avard, seconded by Senator Sherman. All in favor, say aye.
Aye.
Any opposed?
Move to
Okay.
consent?
Yeah, this one can go on consent. Okey-doke.
Do we need to vote on it?
Second.
All in favor? All right. And Senator Avard, being the bill, will take it out.
Thank you.
Okay.
All right. So Cam has proposed,
Two superheroes in the same room.
has provided us with a list. Has everybody got this list? All right. Why don't we start right at the top? So 287 was my bill. Senator Sherman was working with different entities on an amendment.
And we are making progress. This does not have an FN, so. We are making progress. We have one more working group to go on the dispute resolution component of this. So we have one more working group to go on that. And then we'll hopefully have an amendment.
All right, so you got 2 weeks, well, a little longer, I suppose, but this, okay, anyone have any questions of Senator Sherman on that one? All right, good. All right, Senator Avard's bill.
288. I really
288.
love your amendment, and I'm even more in favor of this bill.
All right. I've been contacted by the Hospital Association and others. I've talked to the department. I'm going to give the department and the Hospital Association a couple of minutes to talk about the amendment. We'll start with you, Paula, since you're right in front of the microphone.
Thank you, Senator and members of the committee, Paula Minahan, Hospital Association. So, yes, we did, I actually don't have the amendment in front of me, but we did review it with our members, and we continue to have concerns about it, about the underlying bill and the amendment. We do not believe it is good policy to require the full legislature to have to vote on whether or not adding a childhood immunization to the list of required vaccines. And the other concern is that we have a system now through GELCAR, and that is the process for the rulemaking that the department would have to go through, and we believe that that is appropriate to maintain that. So we are unfortunately unable to support, even though we appreciate trying to soften the language, we still have concerns about the bill.
So you'll be, what, 10 minutes? Okay. All right, Senator Sherman's got to leave for 10 minutes, but I think we can continue without Senator Sherman for now. Is everybody all right with that? We won't take any votes.
No.
All right, are there questions of Ms. Minahan? Senator Avard?
Nope, I'm good.
You had the-
Oh, sorry.
You're showing red, brother. All right. So Paula, before you get, yeah. So, as you know, I've been wrestling with this, just as we wrestled with House Bill 220 last year. I guess my question is, given the fact that the COVID vaccines are so new that they haven't had the kind of time testedness that the vaccines that I got when I was a child, and just about everybody in this room got when they were a child, and they've stood the test of time. Is there, I guess what I'm going to ask is this, is if you're opposing the bill and the amendment that would give greater legislative oversight to the requiring them as, for childhood, whether it is school or daycare settings. What would your thoughts be if we were to have a study committee, study commission that looked at how the department arrived at listing a vaccine on the list?
I think that is a elegant solution.
Elegant. Somebody took a chainsaw to my big nose if they're saying it's elegant.
It's definitely elegant. We can add it to it, but I do not want to change your amendment. But if you want to add a study to it, I would be very happy to.
Okay.
I just, and I see we're at a crossroads. However, I'm still in strong support of this.
Okay. All right. Thank you, Paula.
You're welcome. And I believe New Futures is here too, and I know that they also have strong opinions or a voice in this matter, so I just wanted to mention that as well. But thank you. Thank you.
I didn't.
I'm sorry, New Futures, Kate Fry.
Okay. John?
Senator Bradley, thank you for the opportunity to come before the committee. Thank you also for the opportunity to reaching out to our agency and other stakeholders. I just want to emphasize for the record that the department does not have any intention to moving forward with mandating in either of these settings, whether school or in the child care licensing arena. We do, I think that Ms. Minahan raised very similar concerns that I think the department still has lingering, but again, we appreciate your always earnest efforts of trying to come up with an accommodation. Certainly, the proposal of a study committee to looking at this, we would agree. I can't come up with as good of a word as elegant, but I would think it would be productive and helpful in exchange of the bill as introduced and or through the amendment. Thank you.
So I've had a couple of conversations with Ms. Tilley. She indicated to me that the department could live with the amendment that I proposed. Do you have anything more to add on that?
That is my understanding as well. I have nothing further to add.
I'm sorry, which amendment? The first one or the study committee?
This would be amendment
No, the
2022
further legislative oversight, Amendment 502.
2S.
Well, we're not going to take any action today. We're sort of searching. But, at any rate.
Little River Band, that song, Take It Easy on Me, come on.
All right. Kate, do you want to add something?
Thank you. Good morning. I think Paula has stressed it well. I actually think the study commission is a great idea, very elegant, as Paula stated. The reason why is because I think when we're having all these discussions about COVID, we need to take a step back and really understand the true process of adding, especially childhood vaccines. It's a very, very involved process that starts at the federal level with the ACIP, with years of work and discussion when they're talking about adding a vaccine. Then there's another process at the state level that involves the department's vaccine selection committee, and then you start the whole rules committee. That's a public hearing, and then you're in front of JALCAR. And it's important to note that the federal government recommends, the federal ACIP recommends 16 vaccines. New Hampshire has only added 9 in their schedule. So they are very, they do a lot of due diligence, and they really look at what's going on here in the state as far as outbreaks. I know that's why they haven't, I think, added meningitis in the past. But why I think a study committee is good, because I don't think people really understand the arduous task that they do to do this. And everyone agrees that nobody's looking at adding COVID right now. We had the Pediatric Association here last week
they're saying the same thing, but why are we just going ahead and taking it off the table without really understanding the process? And I do have concerns about the amendment to add it, have the full legislature weigh in. I just think that's a dangerous precedent when we talk about communicable diseases and childhood vaccines. So I think a study committee standing alone is a great solution at this point.
Mr. Chair?
Yes, go ahead.
Thank you, Mr. Chair. Thanks, Kate. That's really helpful to sort of understand, what happens at the federal government and then, what DHHS does to think through what's necessary for New Hampshire. That's really helpful. So, and my concern about, taking something off the table is that we don't, as a legislature, don't have the information that HHS Public Health might have about outbreaks. Would you agree?
I would agree, yeah. Yeah, and it's a very involved process. They have, even in New Hampshire, epidemiologists and doctors weigh in that vaccine selection committee. And they really have a lot of research at their hands that we don't.
Senator Avard.
Thank you. So is there anything in my bill that would prevent a parent from doing it on their own?
Doing what on their own?
Vaccinating their children on their own?
Nope.
There is nothing. So the whole concept of my bill is to ensure that the parents have that say rather than, and I like to use the word bureaucrats, a handful of bureaucrats. Now, somebody might say, well, you're putting it back to the legislature is the same thing. However, one thing that I've noticed in this whole process is that this has been so politicized, starting with the candidates who said they didn't trust the FDA, the CDC, and on and on. And so they made this political. And there's a lot of questioning of the science on both sides of the aisle. And so the reason I agreed to Senator Bradley's amendment of the full legislature, because at that point, there has to be a political solution. Not a handful, if you will, of bureaucrats that are going to take it upon their own, saying, well, we think that if you're going to be in, say, the National School Districts or the Hollis School Districts, you need this vaccine, whereas others might not, and it should be across the board. But one thing that I'm really concerned about is that the parents will not have a say on this. And the only thing I regret about this bill is the fact that I'm frightened that children may be discriminated. Well, you're vaccinated and you're not vaccinated. You're in a different class of people, and we're going to treat you differently. That is a real big concern of mine. But I think that would be alleviated if the full legislature had the authority, not just JELCAR, because JELCAR, again, is a handful of individuals. I've sat on JELCAR many times. So I really want to protect the parents' choice. There's nothing in this bill that prevents a parent from doing that. I've helped individuals in the past get it, whether it's the children's home or, I'm not an anti-vaxxer here. I just am a pro-parent choice person here. So that is the whole reason why I'm going this route. And I really appreciate your concerns. I know that there are safeguards, but unlike some of the other diseases, it seems as though this has been just over-politicized, and everybody's telling us to trust the science, and then there's people coming out with different information, whether it's on the CDC or the FDA and the changing of the evolving of the disease. It's troubling me, and so that's the whole impetus for why I'm doing what I'm doing. But my biggest question was, there's nothing in this that prevents a parent from vaccinating their child.
There's nothing in that does at that point too, but it also and I really appreciate your concerns about the politicization, because I feel the same way, and I feel to some degree the politicization is affecting our tried and true public health practice on just basic childhood vaccination. So that's my concern about the amendment. But again, no one is talking about mandating the mandate rate, or mandating the vaccine right now. The department isn't, we're not there yet. So I just feel like, why are we taking this drastic measure when already parents have a choice?
And one final follow-up, just as a general comment, and I understand that, but the fear is real in some of the parents as, well, they're not mandating it now. And so this could alleviate some of the fears. And fear has torment in it. And many people are tormented one way or another on this. Some people are afraid that they're losing their rights. Some people are afraid that they're going to get the disease. And it's still, like you said, and agree with me, that it has been over-politicized. And it seems as though we almost need a political answer now that it is.
And I think the study commission is a really good step in that direction, because it really explains the process, because I think we've just lost sight of it because it's been so politicization, that there is a process at the federal and the state level. I mean, the last time we mandated a vaccine was back in 2003. So it's not something that happens overnight. That's why I think the study committee is a good solution to really understand the process. Thank you.
All right. We'll continue to hold on to 88. All right, Senate Bill 320, Healthcare Provider Standards Contracts. I'm slated with Senator Sherman to have a meeting, I think, with Paula this afternoon and Senator Susi. And the carriers. Do either of you want to have an update at this point for the committee, or do you want to just wait, continue to wait?
I don't really have an update. I think we just, that's the update, that we have a conversation this afternoon.
So we have no elegant solution on 320.
No, it's because we haven't met yet. It's coming.
That elegant solution is elusive.
Yeah. All right. Yeah, now it's an elegant solution. You know, I go to the doctor. No, never mind. I'm not going to say this. Okay. We'll wait on 320. Senator Clegg, has Mr. Galvin reached out to you on Senate Bill 372?
He left me a message last night to call him today.
Okay. And I will urge Mr. Galvin to again reach out to you, Paula. Okay? So we'll hold on that bill. We will have Vaccine Day. When we exec 288, we'll exec 374, if everybody's all right with that. Okay.
I'll bring my needle and syringe.
And I'll bring my acupuncture needles. Remember, we allowed acupuncture needles in your ear.
That's right.
Okay.
Well, my biggest regret was that the governor went down the other aisle in Stratham for his booster. I was in the next aisle over. That would have loved to have needled him, so to speak.
Needled him, so to speak. All right, so let's. All right, the next one on our list is Senate Bill 401, Medicaid reimbursement for hospital birthing services. So, does everybody have the amendment that should have been, that was prepared for me by the department?
I don't.
Oh, boy. Uh-oh. All right. All right, let me just describe it.
And we'll trust you.
No, well, we're not executing it without everybody else having a chance to look at it. So, if you recall from the hearing, the department said they'd take it back under advisement. They are suggesting to us that in order, and I'll just read the language, in order to ensure adequate access for labor services for women, the department will increase the Medicaid reimbursement rate for birthing services provided at hospitals by 25% in the aggregate, based on the rate in effect as of June of this year. And then it goes on to say the department would have the discretion to implement the reimbursement increase to adjust for access risk geographically. Henry, come on up. Can you explain that?
Good morning. For the record, Henry Lippman, Medicaid Director. What we're speaking to in Section 2 there is that the access issue is not the same across the state. We have some very tenuous risk in terms of losing, and that the commissioner would have a little discretion in terms of how to apply that 25%. We're saying we appreciate that full 25%, but there may need to be a little bit of geographic adjustment for that to try to buy us some time, additional time to work through some other issues, which are the rest of the amendment that we're proposing here.
Right, the rest of the amendment directs the Taylor Caswell Business and Economic Affairs to try to find funding for the impact of closures of birthing centers, so that there's some data points. And then the third item that, and this is brand new, would be to create a study commission with everybody in the entire universe on it, to look at this whole issue, which may or may not make some sense. So I apologize, I thought the amendment would have been, all right, so we will distribute it and maybe we'll come back to it. I want to make sure that, you know, folks in this room have gotten access to the amendment too, to work with the department to make sure that the intent by adding the phraseology in the aggregate works, okay? Yes, go ahead.
If I could just speak to this, in terms of putting this amendment together, we worked with Taylor Caswell, Commissioner, we worked with the Commissioner of Insurance, and we worked with the Governor's Office to try to craft something that builds upon it. The 25%, I think, is needed in the system to help support continued access. The ability to have some calibration of that so that the Commissioner can take into account, you know, serious situations. And then, you know, Taylor Caswell's perspective on this is that, you know, in terms of the work he's trying to do on economic development, once you close birthing services, you have a demographic destiny of an area, particularly in the North Country, which is concerning to him, and he's very supportive of trying to find some money, and he believes he can to do that. And then the last thing is, you know, this is not all these first steps are sort of the short term to buy us some time, I think, for a longer term look at what's going on in terms of the practice of obstetric care, not only in New Hampshire but elsewhere, in terms of what we might be able to craft to do something to preserve access. Because again, I think the issue of receiving care proximal, in the case of, it's not a digitized service, it's not a telemedicine service. In terms of delivering a baby, there's a physicality to that that's not going to change. And then the social and economic factors. You know, even when you take it down to a municipal level, in my experience from living in Laconia, once the hospital shut down obstetric services, we had an issue with ambulances leaving town. We only had 2 ambulances, and, you know, thinking about smaller communities, when they have to make that trip, it leaves the community less covered. So there's a whole set of issues, both from an employment standpoint and what have you, that I think need to be taken account before we just let the system sort of collapse, because once it goes away, it's much harder to put it back together again. We see that in the area of mental health in terms of all the money that the state's having to invest at this point. So, do you want me to hang around, Senator?
I think there might, now we have the amendment in front of us. Yes, I'm sorry, go ahead.
Thanks, Henry. I guess I have sort of 2 questions. One is just to clarify, when you say, I'd like to use the term wiggle room in terms of how to adjust the reimbursement, you might have one hospital or one birthing center get 5% increase and another one 35, 40% income, maybe not that big, but
Yeah,
that's what you're talking about in terms of being able to tailor it to the needs of the community.
Right, I think really our biggest concern right now is in the North Country. We've got, relatively low volumes, more fragile hospitals. There's also the western part of the state that is also of concern. There's, during the last couple of years, we've had hospitals approaching us saying, we're about ready to close this down. So I think in terms of the wide scope that you described, I think it'd be much narrower than that,
Right.
because the number of births that would be subject to the increase would be much smaller.
Quick follow-up, and do you envision this being part of a package to incent programs either to continue to provide services or possibly even reopen programs that have been closed, especially up in the North Country?
I'm not sure, based on the volume of the North Country, it's reasonable to expect that some new ones would open. I think this kind of builds upon one another. First is the 25%, I think, hopefully buys us some time, and then the ability to understand the non-healthcare aspects of this, the economic and social welfare impacts on a community, gives policymakers a chance to think through, how we want to let the system evolve. And then finally, I think it's, trying to bring the best minds together in the state to look at, how do we, for the long term, provide women and their children a reasonable access to it, so that we're, taking into account all the factors, not just the direct cost of the delivery, but the entire impact on the community and at large.
Another one? Nope. Oh, okay. All right, so, I don't see, I think we should read this, look at it carefully. I think this study commission has 30 members on it, which is,
One too many senators.
well, yeah. So I took it upon myself to do a little bit of scratching. I knocked one senator off. I thought that one physician would be ample, one midwife. Since the department's already on it, I thought we may not need numbers 21, 22, 23, or 24, but that's just me looking at it quickly. I think everybody else should, look at this. And
I have an email it's originally from John Williams, that on page 2, line 31, if we're going to be making changes, the word "the" needs to be inserted, appointed by the New Hampshire Municipal Association.
Oh, okay. Thank you. Okay, everybody all right with the direction of this? Go ahead, Henry.
I don't have an issue with looking at the commission. I guess one thing I would say in terms of the obstetrician's a key part of the team, but to survive, a service needs the pediatrician to be able to deal with the post-birth issue as well as anesthesia support. So I think, maybe there's, in terms of the clinical participation, I think those are key perspectives, and they don't necessarily have to be on the commission, as you've done on Granite Advantage. You bring people in to make presentations, but I think that's important perspectives to add to it.
Okay,
Thank you.
thank you, Henry. We will continue with that one. All right. Senator Whitley and Senate Bill 416.
Thank you, Mr. Chair. So there have been a number of folks working on this. The Office of Child Advocate, Rebecca Ross from the department, and New Hampshire Legal Assistance have been working on an amendment. And I believe I don't know if everyone wants to come up together. Michelle and Emily are here to discuss the amendment and how the group came to it.
Okay. I'm right up here. Yes, please. Thank you.
And I'm sorry, the amendment is 0716S. guys are
morning,
up.
Chair Bradley and members of the Health and Human Services Committee.
Emily,
Emily
speak
Lawrence.
right into the
Oh,
microphone.
Can you hear me now?
There you go.
Okay. I'm Emily Lawrence. I'm the Associate Child Advocate. And we have been working with Rebecca Ross from the department and with Michelle from New Hampshire Legal Assistance. A couple of the changes that we made were made to address the concerns of the department. The first one is in, so if you go to, let's see, page 1, lines 31, there we included children involved in 169B, C, D, and 135F, and that was to address the concern that the functional behavioral analysis apply to all children and not just children involved in abuse and neglect cases.
And so that's by citing all those different statutes?
Correct.
Okay.
That's our understanding, that that would cover all of those individuals. That would be broader, yes. Then on page 2, the department was also concerned with the initial language that had them seeking reimbursement if there was, from the school district, if there was a need for the functional behavioral analysis through the school. And so we adjusted that language to say that if the school district has not or will not complete a functional behavioral analysis and it is not related to their educational needs, the department shall obtain a functional behavioral analysis through the care management entity. So that also ties it into the care management entity, which is so that they can help facilitate the analysis. And it removes that requirement that DHHS would have to be chasing down reimbursement money.
Senator Sherman?
Just a quick
Yes.
question. You may have just answered my question, but my understanding is that this is the responsibility of the school district fiscally. In other words, they're responsible for doing this assessment. Correct me if I'm wrong. I just want to be sure that we're not shifting a school district fiscal responsibility onto the department.
That's a great question. I'm going to let Michelle answer that because she understands the educational piece a little bit more.
Okay.
Thank you, Senator. So my name is Michelle Wongren. I'm a staff attorney at New Hampshire Legal Assistance and the director of the Youth Law Project. So we do quite a fair amount of work with school districts. And so currently, and later on in the amendment, it sort of addresses sort of that delineation of responsibility between school districts and the state, because we heard that that was one of the major concerns, is are we shifting what is already the responsibility of the school district to DHHS? And we certainly don't want to duplicate efforts or create inefficiencies in a system. So currently, the special education laws require that when a student exhibits behavioral difficulties in school, particularly when that leads to what's called a change of placement, so removal from a classroom for more than 10 days, the school district is required to, in most instances, but not all, to conduct a functional behavior assessment. Last year, the law changed to apply the standard for creating a behavior intervention plan to even non-disabled students. So if there is a pattern of behavioral problems in the school, students are now entitled to a behavior intervention plan to try to address those problems. What the special education laws don't have, though, is what does it mean to create, to conduct a functional behavior assessment? And so that's something that we tried to address in this amendment, is really getting at, if we're saying that the school is responsible for addressing school behavior and the care management entity is responsible for assessing community-based behavior and home-based behavior, what does that all mean and how does it interact? And so what the bill does, or what the amendment does, is it creates a standard for what is the responsibility for the school and what is the responsibility for DHHS. And it does that in a couple of ways. First, you'll see in page 2, lines 35 to page 3, line 4, it creates a definition of what a functional behavior analysis is and who conducts it. And we tried to make that definition expansive, so it may include an assessment by what's called a board-certified behavior analyst, which is the gold standard. But knowing that there's a workforce shortage in the state, it's not limited to a BCBA. It could be any trained behavioral analyst could be the person conducting the assessment. And then also to try to get at when is it the school's responsibility and when is it the care management entity's responsibility, we created a process for a school district to adhere to determine when a behavioral assessment is necessary. In the special education laws, it says that when a student's behavior interferes with their learning or the learning of others, the school district must consider the use of behavioral interventions and supports. So this standard in page 2, lines 11 through 22, creates a standard for when a school needs to conduct the assessment so that it doesn't then fall on DHHS. We know that kids' behaviors are so interrelated. They're typically not confined to one environment. And so when they're confined to the school environment, this standard, that the child has either been repeatedly suspended from school, receives repeated disciplinary referrals, is involuntarily separated from the classroom, that is when it becomes the school district's responsibility to assess that child's behavior in school. Now, if their behavior is also preventing them from getting to school in a way that is educationally centered, the school's responsibility may extend beyond an assessment strictly in the school environment. On the other hand, however, if a student is doing just fine in school, but their behaviors are confined to the community and at home, it would not be the school district's responsibility at all to conduct the assessment. So what this amendment contemplates is that when a behavior is confined to school, the school will conduct the FBA. When a behavior is confined to home and community, the care management entity will conduct the FBA. When it spans across environments, it's a little bit more complicated, but generally we anticipate that the responsibility would be shared. And I think that there could be some caveats to that depending on what's driving what, but generally speaking, that would be what we contemplate.
Yeah, and Mr. Chair, may I? So, Michelle, I think what you're describing is something that I'm familiar with also. When we're talking about very high-need children that are multi-system involved, this legislature has done a lot of work to try to make sure that the system doesn't interfere with these kids getting what they need, right? And so is it your experience, as it was mine, is that when you have a multi-system involved kid, high-need kid, a lot of time agencies are going like this: you're responsible, you're responsible. Is that your experience?
That is absolutely my experience.
And do you think that this amendment sort of clarifies for the kiddo, right, about who is responsible and who is not?
It does, because it clarifies when the school should be conducting the assessment, when DHHS should be conducting the assessment, and when they should work together, so that they're not pointing fingers and determining who's liable. And it also, I hope, addresses DHHS's concern that they don't want to be a debt collector to the school districts. We don't need them to be a debt collector. They have enough to do.
So, go ahead.
So, the key in my question is, if the child's school district has not or will not complete a functional behavioral, this is page 2, line 2, and it is not related, I get that. That's what you were just talking about. But what if it is related to their educational needs and the school district? There's already a system in place to hold the school district accountable for not doing the needed assessment?
Yes.
Is that legal?
Yes. So it's called a due process. So in the education world, if a parent disagrees with a decision made by a school district, they can request a due process hearing with the Department of Education to contest that decision. What this bill language does is it creates a standard for when a school should conduct an FBA and what an FBA means, like what is the definition of that, which is currently lacking in the law. So we think this clarifies the obligations to hopefully enhance the efficiency of both systems.
So, have you worked with the Department of Education on this language? Because this is all new. Sections 3, 4, 5 are all brand new.
That's right. No, we have not. This has been directly in response to the department's concerns about the finger
The
pointing.
Department of Health and Human Services.
That's right. That's right.
Okay. So,
Oh, okay, that's a good point. If we want to hold on this, we can get input from there is her name's Becky, I believe, the head of of special ed at
I think
DOE.
that if you
Sure.
could do that,
Yeah.
I mean, I don't see any reason
Sure.
not to move forward with this, but I also want to make sure that
Yeah.
education has been.
We can do that.
Because it is brand new, it hasn't had a public hearing, at any rate, okay?
Sure.
Okay.
Pam?
I did just notice on page 3, line 1, the first word is nay, and I believe that should be may.
Eagle eyes.
And while I call this John Williamsing, he's the, what do you call those kind of corrections that you make? Anyway.
Enroll bills.
Scrivener, there you go. I call them Williamsing. Line 2, after the word review, is there supposed to be a
What
comma?
page?
Page 3. Comma after review.
Well, I think that when we get into voting on that, we can look at that, all right?
Right there.
So I do want to hear from the Department of Education, make sure that they've been consulted, that they're okay with this, and then we can move forward.
Great.
All right, we're going to go a little bit out of order now because we just got the amendment on 458, which is the Sununu Center bill. And Director Ribson is here, and I don't want to keep him sitting here too much longer.
Do we have an amendment?
We're not, it's coming. I asked the department after the hearing last week, because they had come in opposed to the bill, the way it was
Thank you.
written, to draft an amendment, it's in my name, as to where they think that this process should go. So, gentlemen,
Good morning, everybody. Joe Ripsum, Director, DCYF. Thank you, Senator Bradley, for bringing this forward. Would you like me to just kind of walk through what we're
Yeah.
envisioning here? Great.
and
So,
you can point out on a global scale the differences between
right.
what's here and what was in the original version.
Cam, do we have extra copies for, okay.
Great. Section 1, Roman 1 rather, sets forth the responsibility to construct a secure treatment facility, no more than 18 beds. That no more language was in consultation with some of the folks who have been working on this, with the idea that at this point we believe 18 beds is the right number, but there's probably about a year-long process of designing with an architect, and if the data shifts during that point, we don't want to be locked into 18 if we think it could potentially be 16 or 14. But no more than 18, I think, is what satisfied everybody in terms of the size of the facility, knowing that giving us a little bit of wiggle room just in case the data seems to suggest in the coming year that that could be smaller.
All right, let me,
Sure.
because we're right at this point now, has the department identified a new location at this point?
At this moment, there's not a locked-in new location. There's a couple ideas that have been considered, but there's not a locked-in new location.
I would recommend that we probably should take out in the southern portion of the state.
I wouldn't object.
But that's,
Yep, and that language was consistent with the committee's hearings in the fall around, that's where the vast majority of the population is.
and I get that.
Yep.
Nothing precludes that, but at any
Right.
rate. Okay, go ahead, Joe.
Facilities shall be operated by the Department of Health and Human Services. That is different than what was in the other version of the bill, which had this being privatized with a contracted entity.
Yep.
Facilities shall be designed to meet the unique needs of youth who are at the facility pursuant to list of statutes, detention, commitment, transfer to Superior Court, service of adult sentencing, so if somebody's sentenced as an adult, but during their minority, they remain within this facility, and for the Interstate Compact on juveniles, which is when you have children from other states engaged in criminal activities that tend to require a temporary detention status. So basically, this would be the facility for all populations who are detained and committed within the state of New Hampshire, male, female, regardless of any other thing. Same population that was envisioned in the other bill. Upon opening, facilities shall be referred to as a youth detention center as referenced in RSA 169B and RSA 621. That's just to make sure that the existing statutory framework that guides the operation is consistent when the new facility opens.
Did you mean development or detention?
Oh, that should be detention. Thank you. Is it, John? Why do you say it's detention or development center?
I like development.
It is the Youth Development Center.
It's development, thank you.
It is development now,
It is
isn't
development.
Right, because there's committed kids and detained kids.
Okay.
So it's
Go
right
ahead.
business. Facilities shall have the capacity for alternative flexible use when the census so permits. The idea behind this is a couple-fold. One, that if there was to be a drastically reduced census and the facility potentially could be used for another purpose down the road, we talked about this at the hearing last time, but building something that could be used as a qualified mental health center or something like that rather than a detention facility if the facility gets small enough. Or the idea being that if the census is small enough and there's amenities within this facility that could be used to help other populations, that we'd be open to that. Not locking in exactly what that looks like because there's a lot of unknowns, but just the idea that during the design process, we should be open-minded about uses of the facility. Roman 2, Department of Health and Human Services in collaboration with the Department of Administrative Services shall issue a request to procure a qualified design-build architect on or before August 1, 2022, and shall collaborate to select an architect, procure the resulting construction project, and complete the project on or before June 30, 2024. The SYSC shall be closed for incarceration, detention, and admission of any child upon the opening of the new facility. This is different from the other bill. Timeline in the other bill was March of 2023. I testified last time that I didn't think that was realistic even in that framework, but that is a change. So all of this going forward in Roman 3 is different from the other bill. I don't know that the other bill precluded us from doing these things, but the other bill just wasn't specific as to these things.
So this, as I understand it, outlines the therapeutic component of what you're trying to achieve.
Correct.
As opposed to strictly detention.
Correct. Roman 3 goes into kind of the physical facility design aspects, and Roman 4 goes into the programmatic aspects.
Yep.
So, you want me to go line by line through this, or?
You can if you want to, but I think it's,
I'm happy not to unless folks would like me
Yeah.
to.
yeah, go ahead, Senator Sherman.
Thank you, Director. Just want to make sure that, in your opinion, none of this would be limiting in the future. As you know, the standard of practice changes over time, and this is fairly specific. And just making sure that it allows enough leeway for advances especially on the therapeutic side.
Right, yeah, so I think, and you're really talking into Roman 4, so I'll jump ahead to
Right.
there. Yeah, the way that we wrote this, we tried to leave it, specific enough to be sure that folks understand that we're serious about moving to this clinical and therapeutic model, but open enough that things could change over time. So specifically, I'd refer to Roman 4B, talks about the use of evidence-based practices. That term is defined in the system of care law, but that's a term that changes over time with evidence, right? So I think that's kind of how we try to accommodate for that, is being clear that we do want to use evidence-based models, but also being clear that we know that that's something that may change over time. What you'll see in Roman 4 is a lot of references to 170G, and again, that's the system of care law, and the purpose of that is that the idea of this new facility is, historically SYSC has kind of been treated as an island outside of the rest of what kids experience through child protection, juvenile justice, behavioral health, everything else. That doesn't make any sense. It never made any sense, but it particularly doesn't make any sense in the context of the new system of care that's been built. So the idea here is really to very purposefully cross these two statutes so that when kids are involved at SYSC, they are also involved with the system of care. Specifically, I would point to 4C, which talks about the use of the uniform assessment. That's the same assessment that's used in the system of care to figure out what kids' levels of needs are. And to, where's the one that talks about care management? D. Roman 4D, which talks about use of care management entity upon admission. That's so that when kids do go to SYSC, even if it's for a short-term detention, you very quickly get that wraparound service in place to try to help make sure that that kid is ready to be discharged and stabilized and safe in the community, thereby preventing recidivism and preventing a lot of the things that we've seen over time. The other pieces in here, are really just around kind of standard stuff that you would expect when caring for kids, right? Recreation, large muscle movement, access to therapy, frequent access to family, things like that. We did add a 4H in here based on some of the concerns that we heard at the last hearing around oversight, just being very clear that the Office of the Child Advocate has access in real time to the electronic case management system, so any incidents that happen, the OCA gets them immediately, typically sees them before I do because I'm not on my email all the time, and has regular access to the use within the facility, regular access to the video surveillance, and general access to the facility at large. Certainly open to other ideas around things we can do there. I know that's been a serious concern of the committee, and it's a serious concern of mine. But this is kind of where we thought we could build in some of that oversight that folks were concerned about. I'll pause in case there's questions around that before I move on.
Okay. Yep.
Just a quick comment, when you're looking for a location, I don't know how big the campus is, but given the therapeutic component of this, it would make sense to potentially build on the grounds of Hampstead Hospital.
Mm-hmm.
I don't know if you've thought about that, but.
Yeah, I think there's a lot of options under consideration.
Yeah, it's
But
just having the therapist, the psychiatrist, all the supports already there might be a.
Mm-hmm. Yeah, and I do, we did talk in the committee that there's multiple rationales for having the facility placed in a setting where you have other types of comparable children's services. In addition to kind of the synergy of the therapeutic relationships that you're talking about in the mental health system, part of the ongoing costs of SYSC, which are high, is because the economies of scale are such that operating, nursing, nutrition services, facility services at a standalone facility that's serving a small number of kids is pretty high. So the ability to co-locate in a way that's close to other types of facilities that serve people makes sense. That doesn't mean it's necessarily that location. It could be other locations up here in Concord area or somewhere else, but the ability to co-locate and share some of those services and staff, education is another one, is something I think would be worth everyone's thoughts as we go through the location identification process.
Mr. Chair?
Yep, go ahead.
Thank you, Director Ribson, for presenting this, and it really is a dream come true to hear you say that, this Youth Development Center should not be an island unto itself, because I think that is the reason why we have seen so many horrific things happening down there. So I truly appreciate the connection to what this legislature has been building together with you and others, the system of care, making that connection. So we're really making sure that they're all the same kids. We know that. So my question is sort of thinking through, these higher need kids. Do we have adequate language in here connecting these kids to services like MST? So a kid who might get MST wouldn't necessarily be in the system of care. So that's my first question. The second question is, you have in here August 1 as a date to get the architect. Can we move that up a little bit? I know that there's a lot of urgency here, and so is that something that we can think about pushing forward a little faster?
Yep, thanks for the questions. I'll take them in order. In terms of the first one, I don't know that you need language in the SYSC bill around accessing the system of care, community-based services. That's the purpose of having the care management entity involved. That's the purpose of having, DCYF at large involved. MST is a great program that we recently contracted with. It's evidence-based for working with this type of population and keeping kids safe in the community and out of trouble, so you don't have to have them go to not only a facility like SYSC, but even a residential setting, right? It's really targeted for that specific purpose. So it's a great addition to the services and something that I think is going to be really meaningful. Again, I don't know that we need to cross that in here because it's covered in other parts of the way the system works. The second question in terms of the date, part of that was just trying there's urgency certainly on our part to do this as soon as humanly possible, but also understanding the legislative calendar and that it's unlikely that a bill is finalized and signed much sooner than late June or July. So that's kind of what drove the August 1st date more than anything else.
Real quick, just, and thank you, and I know that the governor is very, very concerned about this whole issue. You mentioned it in his state. Said himself he'd like to get into a bulldozer and just do that. Have you run this by him yet?
There have been conversations with the governor's office. I don't know that there's been a line-by-line approval of everything in here, but we have had conversations.
Thank you.
Any other questions? So, two things. The price tag seems to have gone from 11 to 15.
That was based on information provided to the committee in the fall by Commissioner Arlinghouse at DAS. So in the fall, there was a request from DAS for what their estimate was of the cost of building something like this. They itemized a bunch of things. That was where the price tag landed there, so that's what was included here.
So my second question is, despite the urgency that we all feel, I'm concerned that there's no safety valve given, prices are escalating. That means that there could be steel shortages, construction delays, not enough workforce to build it, yada, 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 yada. So my question is going back to, that date on line 18, should there be some sort of override either by the governor and council, by the fiscal committee, something like that? Before everybody blanches in the room when I say this, we've been here, we've done this, this must be the 6th year that we've been, debating exactly this policy. We've backed ourselves into a date that's totally unrealistic, and I don't, quite frankly, want to do it again.
Yeah, I don't disagree with thinking about some mechanism to do that. I would say the department is very committed to meeting this date. I would say the governor's office, from all my conversations with them, are very committed to meeting this date. That being said, the realities that you raise are realities that, that folks are going to have to address over time if problems do arise. So whether the mechanism to resolve that is building in some type of safety valve that you suggest, I think that makes some sense, or whether the mechanism is at some point there's a return to the legislature to address it if there is a problem.
Mr. Chair?
Well, if we don't want to oversee vaccine policy, I don't know why we want to oversee construction policy. Sorry, that's a...
Is that support my bill?
That is Bradley expressing frustration because we've been here, we've done this.
That's right.
On this, and we're in the same place. And now we're having to fix it yet again.
Mr. Chair?
And you know what? Joe, you've done an unbelievable job since you've come on it, we've gone from, when we first started this discussion of having 75 or so kids at the Sununu Center down to an average census of around a dozen. Hats off to you. Hats off to John. Everything the department has done. Senator Whitley has done a great job working on the system of care. We've appropriated a boatload of money, as well we should, to solving this. But let's be adults here as we're debating this bill and not let the perfect be the enemy of the good, and make sure that we're not here again a year from now when we don't know what the world's going to look like in terms of some of the things that would interfere with a construction schedule. Sorry. Now you can kick the soapbox out from underneath me, but...
Well stated. No disagreement from me.
So
Senator Whitley.
yeah, my interest, I agree with that.
Good.
I have that same frustration. No, because we keep coming back to it. That's why I think a timeline is necessary to keep this trucking. I mean, a safety valve I could consider, but I don't. So I'm willing to consider a safety valve, but I think the timeline is incredibly necessary.
I'm not saying alter the timeline. I'm
Cool.
saying provide a realistic
I'm in.
safety valve. Yep. All right. Any other questions of Joe? All right. I would ask you to have a conversation over the break with Senator Daniels, because he, ended up chairing the committee that, you know, was really focused on the date. And the date drove the policy. And guess what? That's what I'm trying to make sure that the policy is the right policy. I think we all agree on that here. But if I were Senator Daniels now, I probably wouldn't be too happy. So, and I think that some of the advocates should reach out to Senator Daniels too. So I'm looking at who you are and what you need to do, okay?
Understood.
All right.
Thank you.
Thank you, Joe.
So I guess we're not execing that, huh? You gotta have one of us.
Yeah. We're getting right there right now. I know. All right. All right, let's go. We'll do 446, then 444. Okay? So go ahead, Senator Whitley.
Let me just, there are people outside. Can I go grab them?
Yep.
I'll grab them. You go ahead. Oh, you want them there.
Okay, so Senate Bill 446, you should have Amendment 0704 that was distributed last week. So this amendment does a few things. The first thing it does is, if you look on page 1, line 14, instead of, the initial version of the bill said one entity, but what I learned is that there's a regional structure being developed through the preschool development grant, and so allowing it to be one or more entities recognizes that, as does line 17. Line 16, the designated entities may be New Hampshire Early Childhood Regional Lead. That's that regional structure. So we wanted to recognize that infrastructure that was building. The other thing that it does is clarifies some things that the department had raised in the hearing, just cleans up some language about what's permissible under federal law, what's not. So we incorporated all of the changes requested by the department, except one issue, which I think folks feel strongly on one way or the other. So that is the inclusion of, if you look on page 126, the State Early Learning Alliance. And I'm not the person to describe what that is. So the reference to what's called SELA, State Early Alliance of New Hampshire, that references in 2 places in the bill. The department has requested to take that out, but others feel strongly that it should be in. So I didn't think it was my place. I think the committee should hear from folks, and then we'll leave it to the committee about whether we should take it out or keep it in. So I think Jackie Cowell is here. I think, John, I don't know if you wanted to speak to it or Karen Eburn wanted to speak to it. Okay.
All right. Anybody want to add anything?
I think Jackie Cowell is here to talk
Yeah,
about
go ahead.
SELA. Thanks.
How do you do? Good morning again. I'm Jackie Cowell from Early Learning New Hampshire. Our nonprofit organization is the home of SELA, the State Early Learning Alliance. And just FYI, we do have some folks from Rochester Child Care on the road here if you have any more questions. But there's also Mark McMurphy here from White Birch Center in Henniker. So what the State Early Learning Alliance is, it is an economy of scale model that is recommended in the New Hampshire Early Childhood Strategic Plan as something that should be handed out and given as a membership to the field, because it helps save money, both for the programs, it helps save, it's a cost, sort of an opportunity for joint buying It helps put dollars back in the pockets of the workforce very specifically in a variety of ways. And so that strategic plan that was passed, a public-private plan, put in June 2020, recommended membership in the State Early Learning Alliance. So we put it in here in this bill as part of the bonuses and benefits.
Just for the committee, it's on, the reference to SELA is on line 27 on page 1, and then also on page 2, starting at line 27.
And I did hear in the very first hearing of a worry about putting state, a sole source into statute as part of the, but haven't had any discussions about that since. So that's why we're here today.
That was an issue raised by the department. I don't know if that's been alleviated.
All right, any more questions?
Oh, may I add one more thing?
Yeah, please.
So Senator Bradley, Lou Gargiulo, whom I think you know, is part of one of the business partners on the State Early Learning Alliance, using his clout to help childcare programs through this service. Great.
So, Ms. Hebert and Ms. Santiello are not here from the department. Senator Hennessy and I had a conversation with them late last week. I think we should continue to hold on this bill. I would urge you to also reach out to them.
No, and I've had conversations with them, and they, that's why we were supposed to be here today to discuss them. I think it's up to the committee about whether we should keep it in or keep it out.
Okay.
That was the sort of point of today,
Well,
I think.
Senator Sherman?
I'm just wondering, so is the objection of the department that an entity is named, and is that the?
No, well, John, go ahead.
Senator Bradley, thank you, members of the committee. My understanding was that was our concern on the bill, that concerns around sole source contracting by identifying, and we do appreciate Senator Whitley giving us the opportunity on her amendment to express our concerns around that. And I think that if this committee didn't address the concern with the amendment, certainly I think it would be a concern for future committees that amendment, if it were to be heard, would have around that. And pretty much concludes my commentary around that. But we always appreciate the opportunity to engage more fully on how to best utilize resources that are out there to accomplish the good. And we would look forward, we apologize for Associate Commissioner Santiello not being here and Director Hebert, but certainly as Senator Bradley has suggested, we are certainly available to you, Senator Whitley, on ongoing conversations regarding to accomplish the betterment of the good. Thank you.
Senator Sherman?
John, is there a reason specific to the State Early Learning Alliance that you would not anticipate funding this or going along with the bill? In other words, the line in 27, all licensed shall receive ongoing free access to the State Early Learning Alliance. If you were to replace that line with something that described what the platform does that mean that the state is not going to support the State Early Learning Alliance?
And,
or is that what you're looking for, is something that doesn't actually name something in the statute?
So, Senator Bradley, if I could just, for clarification for document control, I have the bill as introduced. I have a proposed amendment 0276S, so I don't think I'm working off the same
No,
document.
John, I sent it to you last week. It's 0704.
And I will say Senator Whitley does her homework, and she does send information out, so I now have, so Senator Sherman, if you could direct me to
Line 27, page 1. And all I'm trying to make sure of is that this isn't a problem with any specific program, but rather a problem with the wording of the bill.
The concern here is regarding identifying a particular entity for this particular web platform. That is a concern, and I think one that's universally a concern regarding sole source contracting. And we just wanted to bring that to the committee's attention, and we're concerned as this progresses forward by naming a specific entity. Not that they wouldn't be perhaps a viable entity once we put the matter out for contract, but putting it in there solely creates issues around the procurement process.
But, so, John, is there a, excuse me, may I, Mr. Chair? The department doesn't have a contract with them now, right?
I don't know the answer to that question. We have so many contracts.
I think Jackie's saying no. So I think
hundreds.
this group actually, my understanding is that it operates separate from the department, that it's just a shared service platform for providers to use if they want. There is not a contract with the department. So I don't see the sole source contract being an issue because there is no contract.
Again, that was my understanding, that that was the department's concern. So if you have a different understanding, Senator Whitley, I would rely upon your understanding.
I don't know if Jackie wanted to speak about how it currently operates. Because I certainly understand we don't want to put a sole source contract in there, but this operates separate from the sole source contract, and it doesn't mandate people to participate in it. It's just available.
And I think at the end of the day, Senator Bradley, the department's request is to remove that section, not that we wouldn't work collaboratively, because they're a great group of people to work with. Ms. Cowell has done some stellar work, but our concern is specific language that's in that provision, and we would respectfully request, if this amendment were to move forward, I understand we're not at necessarily a juncture, but if it were, we would look to having that language removed.
Okay.
I would like Jackie, so here's the thing. I've heard from the department, I've heard from them. I think, I don't, you know, I want to sort of flesh this issue out here and have the committee make a decision rather than have, you know, I think I understand the issue enough. You know, I think it's a committee decision about whether to leave it in or not. So I don't know if, Jackie, if you want to, I just don't know if this is necessary to hold unless people want to have more questions. I think this is the time to sort of flesh that out. Jackie, did you want to add anything? Well, folks are here.
So just real briefly, you know, when Senator Whitley told me the concern and some of the suggestions. So in the, there will be a grant management entity in this bill. There, you know, the Council for Thriving Children and the New Hampshire Child Care Advisory Council will jointly, through RFP, be looking for a grant management entity to put out the bonuses and benefits to the employers, and it would be CELA as well, for those who choose it. So our organization would not be applying to be the grant management entity. So it's, again, and that may not be the department. It may be like a United Way or et cetera. So, and then the way it's written is that the programs would say, yes, I'm interested in the CELA membership, or they don't. And so the money goes to the employer, and then the employer pays the membership. So it's not a direct dollars to Early Learning New Hampshire through the statute. Yeah.
So was I correct that there's no there's currently no contract? So
No.
is my understanding correct that I fully understand we don't want to put a sole source contract in statute, but because this is just a permissive thing, right? We're not
Right.
mandating. Okay. All right,
Exactly.
thank you.
And no child care program is required to request it.
Right.
It is simply something that has been very beneficial for child care programs, especially for their workforce as well when they use it.
Thank you.
Okay, great.
Thank you.
So, John, maybe you want to comment on this, but the conversation that Senator Hennessy and I had with Commissioner Santiello last week, there's some concern on the part of the department with a grant program in general and a feeling that if we were to appropriate $9–10 million, it would be better to go into, you know, building infrastructure that would in a way lower costs to providers, that would lead to, you know, either lower rates for clients or potentially better pay, which is what the bill tries to get for providers. Do you have any Anything you want to add on that since Commissioner Santiello is not here?
Yeah, and Senator Bradley, thank you very much. So we would suggest, I would suggest that we be given an opportunity to update Senator Whitley and to request that the matter be at least held for an opportunity to have that conversation to making sure she's updated. I apologize, timing could always be better for these conversations, but I do want to say that we are available to discuss if there is a different road that could be considered that would be for the betterment of the good.
Can I just say that this bill has had a full hearing. It had incredible support. That has had no opposition, and I feel like this is something that the committee is ready to vote on. There's been so much information, so much press about it. It's a well thought out proposal. If there were concerns, I would have hoped that the department would have raised that in a public hearing rather than in meetings. And frustrated that I haven't heard those concerns also. And, if those are concerns, it needs to be in a public hearing.
Yeah, go ahead.
I agree with Senator Whitley, and I also, I'm concerned that if we wait for an indirect solution to this by changing infrastructure and not going directly to the problem, which is workforce, which this bill addresses, we will be putting this off further. If I were in a business right now trying to build my workforce, which most of the businesses in the state are trying to do, I'd be looking at signing bonuses. How do I recruit? How do I retain? And, the building, the infrastructure is not my highest priority if I can't even hire people to come and take care of people. And this one is doubly important because this is the workforce that allows us to have a workforce. It's like, this is more bang for your buck than anything, and in the sense that if we can get a robust child care workforce and we address that directly, then that releases an entirely additional workforce to come and work in our factories, our buildings, our offices and businesses. So I agree with Senator Whitley. I think we need to move forward with this. My only concern is what you've pointed out. I think we rarely put in statute a single vendor or a single grantee. And, but what I was trying to get at, John, was, is there a problem with this grantee, or would we assume that they would be one of the grantees of the program because they exist, they're robust, they do a great job? But I do get nervous. We've run into this in election law and other places with Senator Gray. When there's a program out there, we embrace it, and then the program goes to pot, and we're stuck with it in statute. So that part I agree on. But the part of maybe this isn't the right focus, we have got to get child care workforce, early childhood workforce. We've got to attract them. And right now, the only place they're being attracted is Walmart and CVS. And so that's just what.
I have a middle ground here. So here, infrastructure is great. The department can do that. There's, targeted child care dollars for them to do that. That should happen. What we are hearing from the businesses, what I'm hearing from, our New Hampshire businesses, what I'm hearing from child care providers is that, this workforce issue, these workforce retention issues are not being addressed. Okay, so we need this. They can both happen at the same time. Now, in terms of the SELA issue, I think to address the department's concern, we can just take out lines 26 and 27. Just take it out, and then leave it in on page 27 as a permissible use of the dollars. So take it out so it's not like a mandatory thing on line 26 and 27, and leave it in on 27. Yep, leave it in there, and then take out lines 26 and 27. I think that would, I'm sorry, so on page 1, line 26 and 27, cross that out. And then on page 2, starting on line 27, keep that in. So that's taking out the mandatory nature of it and then keeping in the permissible use of funds if the entities decide to use it that way. I think that's a middle ground. I think if
Senator
we, oh, sorry.
I'm sorry.
Well, I was going to say, if we don't move forward with this, I think it's a dereliction of listening to our businesses and listening to our childcare providers. There is a massive problem. This is a bipartisan bill. Senator Hennessy is a co-sponsor. Senator Carson is a co-sponsor. This is a solutions-oriented bill, and we have got to do something.
I want to make sure that the good senator knows that when I first was hearing this, I wrote that the best solution was interim study on this bill. I think that it needs a lot of work. I think that I haven't heard anything today that that tells me that this bill is ready to pass. I think that, you know, putting in a particular entity in there instead of saying in the bill that, you know, and if we need that entity of whatever, is that it be selected. I think that, you know, the amount of money that we're talking about here is almost $9 million, and that we shouldn't do that, you know, without really investigating what's going on. There are competing things, and I'm certainly not ready to vote in favor of this. You know, if Senator Whitley, you know, pushes us to go ahead with it, she may not appreciate the result that she gets. So, thank you.
The one other thing that I would add, there was a letter that I can make available that I think went from the department to the governor, if I recall correctly, that outlined roughly $130 million of ARPA money that has gone to child care agencies directly, as I understand it, or at least through the department, without going through the process of the gopher or now the fiscal committee. So,
Well, just to address that, because, you know, that is, so through ARPA, there was dedicated childcare dollars for stabilization and discretionary
yes,
dollars.
that's right.
So the stabilization money goes directly to the providers, and that has happened. That's just a stabilization effort. What this bill does, again, broad support, no opposition at the hearing. I just want to make that clear. There was no opposition at the hearing, but broad support. What this bill does is looks at an issue that has not been addressed by the department, and that is the looking at the workforce and what needs to be done to keep these people. They can't keep their doors open because they don't have the workforce. So if they can't keep their doors open, people can't get to work. It's as simple as that. So there has been investment in childcare, but this is another piece to it, right? So there had been dedicated childcare dollars, but it is not enough. I don't know. I would love to hear from Mark Murphy, who has a very well-run childcare facility, to hear his concerns, while he's here. And thank you for coming.
thank you, John.
Thank you, Senator Whitley, and I apologize for wearing jeans. We have a sewer problem at White Birch today. So, I mean, not comfortable clothing. I'm not wearing socks, not because it's comfortable. I'm not wearing socks in case things go really bad. The workforce issue, and I've been working on workforce issues for a long time in childcare. It's a difficult thing because when I got to childcare, there was a 35% turnover in childcare every year, national average. And it's gotten a little bit worse because when you hire people, they have to be qualified, and you have to find them. And if you're like us in Henniker, you got to get somebody that's willing either to live in Henniker or commute to Henniker. And you need things to keep people there. And that has been the biggest focus of ours for the last 3 years, is retention. How do we get these people to stay? And it really comes down to compensation. As the labor market tightens and things heat up, we are competing with other industries. So even if somebody has a passion for childcare, if they see something that's $17, $18 an hour, They also have their self-interest that they're concerned about, and they may make a move, just using that as an example, for more money. So we've been looking to find ways where we can pay people more and keep them there and keep them on a career path. So longevity is also really important. If somebody leaves childcare and they are taking another job somewhere else, it's not just a transition for your admin team, it's a transition for other teachers, but it's really a tough transition for children and for the parents as well. So you want to keep things stable and keep them there. So that was one of the things about this bill that I found really positive. And the other thing, I was thinking about this, and I'm not sure it's really even come up, but we employ a lot of young people. That's what childcare, just the nature of it, it's a lot of young folks that work in childcare. And, you know, as somebody who's older, and I know we all had jobs when we were younger, especially, you know, if you're trying to get a job in the 80s, you're like so happy to have a job, you know. But, you know, if your boss said, I need you to do this, you're like, absolutely, I'll do it. But one of the things that the bill addresses that really I think is encouraging and it helps young people, it helps them to see that, hey, the longer you are at a place, the more money you can make. The better education you have, you're going to get that bonus. There are things like that also in the bill that I plan to use if it passes to encourage our workforce. You know, you got to better yourselves, you got to get better at your jobs. If you're here for a while, you're going to be rewarded. So I guess I would pass that on.
Senator Sherman.
Thank you, and thank you for coming today. I was on the webinar with Taylor Caswell for an hour last Monday, thanks to Jackie. And there are people in the legislature who don't believe this is the role of the legislature, that you should be doing this, or you should be supported by businesses that are benefiting from the child care that you're providing. Is that money out there? I mean, are you seeing the businesses who hire the parents whose children you take care of? I'm trying to think of the different. Are they giving you money or grants, or do you have any public-private partnerships that, or partnerships with businesses where you're actually getting the funding from them?
No, we're not really getting funding from business unless we try to have a fundraiser where we're looking for sponsors, and I think there are people that appreciate what we do and they may be willing to sponsor. But in terms of a direct coordination with business, I know that there's a lot of talk about it. And, you know, why wasn't there a lot of talk about it 5 years ago? Well, business didn't have the need that it has right now. I mean, I'm from a business background. I completely understand when the labor market's tight and, you know, you need to serve your clients or make whatever widget that you're making, you need people to do that. So if that's the case, then, you know, you want to have a workforce. And if you can't get the workforce, and part of the reason is either lack of childcare or housing or whatever it is, you're going to start working to find solutions. And so there is some talk about trying to work with childcare, but the solutions aren't really what I would consider to be healthy ones. I don't know that it's businesses. It's a societal issue, in my opinion. It's not necessarily just because I want a worker, therefore I'm going to. Right now they will because they're desperate, but I'm not seeing that happen, at least at White Birch. But what happens when, you know, the labor market starts to relax or things start to change? It's kind of like when you look at, like one of the biggest joys of being a parent is when your child turns 5 and they go to public school. Because you don't have to pay for childcare. You're so excited about that. But, you know, in a sense, 1st through 5th grade, that's really, even though it's public school, it's a form of childcare also. I mean, your child is somewhere and they're being watched. But from the, you know, on down from 0 to 5, that's not the case. And it's really difficult for a business. I mean, there's been some suggestion of, you know, well, business could pay for all these and make sure these slots are open. But it's, you know, it's very hard to predict if there's, you know, 50 births in a year, let's say in Concord, you don't know exactly where those people are going to be when their child's 3, 4, 5. You can't get a commitment from them. And the same thing for an employer. They don't know, you know, where their employees are all going to come from. It's just not that predictable. So it's hard to put something on the shoulders of business, I think, to say, you need to make this work.
Senator Gray.
My question is, this bill expires a year from June. You spent almost $9 million. Where are you then? Aren't you back right where you are right now?
In some ways you are, but hopefully you've kept people for another year and you can continue on and you found some other methods to keep people there. But yeah, long term, there's a bigger, broader issue that needs to be addressed. But if you don't have the bill a year from now, where are you? Worse than where you are this year. So what direction do we head in? It's a very tough problem to solve. I'm not saying I have all the answers, but it's a step in the right direction. It rewards education. Your workforce is more educated. So there are some good things about it.
Oh, Senator Gray, I just wanted to clarify.
I did ask for a
Senator
follow-up.
Gray is.
So why wouldn't I do what the department is use part of that money, at least, if not all of the money, to find a way to solve the long term, or at least mitigate the long-term effects?
Well, I'm not familiar with the department at all. I don't know that I can speak to issues like that. I have my thoughts on childcare, having come from the business community into the nonprofit world and childcare. But longer term, there are huge structural changes that I think are needed. I think there's a lot of experts in the community that can try to address that. I don't know that it takes $9 million to get the experts together. It's just whether or not there's a commitment on a broad base from society to make some of the bigger changes. But for right now, in the situation that we're in, we know that there are open childcare slots because people can't find staffing. And it's like, what are we doing right now? And that's kind of where my mind's at. I know a lot of people in childcare are like, what are we doing right now? Because it's parents are just, especially with the pandemic, oh my God, parents are just very frustrated. Everybody's trying to come up with a way forward that makes the most sense. And I am so sympathetic to all of you being in this position. It's not an easy one to solve. That's how I feel.
All right, Senator Whitley?
Yeah, Joe, I just wanted to clarify, maybe this will answer Senator Gray's question, that the bill does not expire in 1 year, so the appropriation is just for 1 year. The fund is created, the fund doesn't go away. Then it will be up to the legislature in the budget process to fill the fund however necessary. So this is something that we have heard from child care centers is needed now while those longer term solutions are working. What happens when all these places close in the next year or so?
Senator Gray.
So that generates the next question. This is $9 million, so we're talking 18 million, 27 million, 35 million. We're talking,
I think that's up to the legislature.
where are we, and why shouldn't we go back to the department and say, hey, we need a longer-term solution? And I
Okay.
know we're getting
All right.
far afield
So,
here.
are there further questions of this gentleman? Yes. Last one. Senator Sherman.
Ooh, that's a lot of pressure. Fundamentally,
Pardon me?
fundamentally,
Okay.
to answer many of the questions that were raised today, this is a two-part question. So are we at a crisis level in staffing for child care facilities? And if this does not pass, and if things continue to decline the way you've described, are you or other facilities across the state at risk of closing without this assistance right now?
I haven't seen the issue this bad. Whether or not that means it's a crisis, I guess it all depends on how we define crisis, but I've never seen it this bad. I've been doing this for 8 years. Some agencies, yes, are on the verge of closing. I can't and wouldn't be willing to say it's because of this specific issue, but this is definitely a contributing factor to it. It's just not easy for any business, but it's specifically for childcare. It is not easy to find people right now. And we're trying to come up with those solutions, not just to find people, but to keep who we have so we can at least maintain where we are.
This is the second part. So why do you need the state's help in this? Why can't you do it yourself? Are you on such a narrow margin that that's not possible, or why do you need that? And I'm not,
I understand.
this is not casting aspersions. This is just wanting to clarify the rationale behind
Yeah.
using state fund, or federal funding, actually.
Well, this is the business part of it that I like. I probably have the most detailed budget that I know of in childcare. To make childcare work, I would have to charge so much to parents that it just wouldn't be worth it. And you would have the exact opposite effect. There would be people making a decision to just stay home and take care of their children and not be in the workforce, rather than, because right now you're just at this point where it's like, well, I can go to work and I can make, $30,000 a year, and then I have taxes and whatever. And childcare, I have 2 kids, is, $22,000 a year. And why am I doing this? Why not just stay at home with my children? So we have people that do that. That's kind of the balance where we are. So to make it work, you'd have to raise your rates to the point where it's not very affordable. So in those types of situations, usually the solution, at least in my mind, is a larger entity than just putting it on the shoulders of parents to make it all work. There needs to be some legislative involvement to help look at this, like you say, to have the workforce for the workforce.
Okay, thank you
Okay.
very much. So,
Miss-
Senator Whitley, my advice would be, since I'm somewhere between interim study and ought to pass, waiting until our next executive session.
There are some other folks that came far away if they wanted to say something while we're here.
All right, I'll recognize very briefly.
Thank you.
You can come up together if you want, yeah.
Okay, all right. Hi, I'm Corlin Hoppy I'm the Executive Director over at Rochester Child Care.
And I'm Ann Grassi, I'm the Family Services Coordinator, former state rep, Senator Grace, my senator. I work for Rochester Child Care Center and have been affiliated with them for almost 40 years, either through work or my family attending. And I've worked in the field of child care for a very long time. And I have to echo Mark, I've never seen it this bad. I've never seen so many centers struggling, closing classrooms, not able to find qualified staff, losing long-time staff. We heard in a meeting the other day of a staff member leaving to go to work for Tesla for $80,000 a year. And she'd worked in the field for 20 years. Someone that has a lot of experience and knowledge around early childhood development, and that you would want to keep, you'd want for your grandchildren, you'd want there. I know we received in the order of $140 million in stabilization money through the federal programs. It wasn't stabilization, it was survival. I don't know where they got the word stable. It was to stabilize the field. It hasn't stabilized the field. It's only helped us survive. We're dying by inches. We made a decision, our board at Rochester Child Care, to keep staff. We had given our staff hazard pay in 2020, and that was temporary. We made a decision, and the board supported the decision, to look at our wage scale and to increase our wages, to stop the bleeding, to stop people from leaving our doors. And we told people in the area, other child care centers, because we're part of a statewide learning alliance, early learning alliance, that we were doing this, and we gave them all our wage scale, and we knew it would cause some, people coming and going. If they can make $1 more somewhere else, they'll go. One of our partners has had to close a classroom because they had 3 teachers give their notice. And we found out afterwards that 2 of them are coming to us because of our new wage scale
And that's a horrible position for childcare to be in. We don't want to take from our sister agencies. We work in partnership with them. Part of the alliance was to help us have buying power, insurance, trash removal, the big items that you have to have when
Economies
you
of
run a
scale.
business, in order to put quality in our classrooms. Quality in our classrooms means paying teachers more.
And this pay is $17 to $22 an hour. That is not even enough to live by yourself in a home in the state of New Hampshire. So we're only at the beginning. We've seen our centers go from almost 800 down to 600 in the state. These are real numbers. And just like what Mark said, if we don't get the support now for our workforce right now, while we're trying to stabilize, it's going to cause the opposite effect. You're going to see the state economy just continue to plummet. And really, the 0 to 5, we have to commit to our families, especially during this time of trauma. Our families are going through enough right now. We can't pass the bill on to them.
I look at childcare as a subsidy. We subsidize things in this country that are for the public good. We subsidize oil and gas. We subsidize transportation. We subsidize dairy, and it isn't even good for us. We should be subsidizing the 1 to 5 because it is a public good. The higher quality experiences your children have in those brain-building years, the easier it is for our educational system.
More likely that they're going to stay and want to work in our state because it's not family-friendly right now. I can tell you, I have gone through my master's degree in business, and I have $100,000 worth of student loans, and I couldn't have been happier when both of my children went to elementary school. And I got 50% off at my childcare because I worked for them. Currently, we're offering free, but that's not going to last forever either. So we are trying our best, offering free childcare to our staff, using stabilization money to improve our facilities, but it's still not working.
Any questions?
Just one quick question.
One question, go ahead.
Thank you, Mr. Chair. So certainly, I think this committee, is understanding of sort of, the business problem, right, with childcare centers. But have you heard from, local businesses? And are you aware, what local businesses are saying? And I know that, the Business and Industry Association has identified childcare as like one of their top policy priorities. But have you heard from local businesses on this issue at all?
They're trying to be our best friends so they can get a spot in right now. So we are working with them, and they are begging for the space, but we don't have the teachers to provide them those slots yet. So they want to help. They want to be a part, but we just don't have the teachers for it.
We've had several businesses inquire and have had us answer questions for them when they thought they could open childcare in their business, and quickly found out that it's not a very easy thing to do, and have declined to do it. So they know they need us. But it's like anything, asking business to go outside of their realm of business to support another business. It's kind of a strange thing to ask.
And when we do what's called slot holding, it doesn't allow for more access. So we could promise a business that we could hold a slot or two for them, but just like Mark had said, you can't really predict that. Another family is going to be in need of that slot. We can't hold those slots for businesses in that manner right now.
We try to hold slots for DCYF.
Yes.
Because we're certified to take DCYF.
So those are the ones that we
Supported
save.
families, and that's difficult. Because you don't know what age is going to come through the door. You don't know if it's an infant toddler, you don't know if it's a preschooler. So it's very hard to predict what age group you really need slots for. We do know that infant toddler is totally underserved in this state.
So,
Question.
it has been raised that this is $9 million. It's, I think Senator Gray pointed out that it has, although it's been clarified that this may last longer than a year. But for you, in your business and in other businesses that you're working across the state, or at least you have contacts, is this the lifeline that will keep you and others in operation? And is there any other potential source for this revenue? We've already heard that you can't really raise tuition because parents won't come. But is there any other source of funding available to keep childcare businesses afloat right now in the state?
We don't have enough people running childcare right now to do that. Currently, like, I'll work in a classroom, and I'm an executive director. We have program directors that are going in.
It happens a lot.
Yeah.
That our leaders are having to take nap time and, cover the end of the day in childcare. It's not the lifeline.
Mhm.
It may be one of the lifelines. If you think of it like a boat needing more than one line to hitch itself to a dock. We have a group that's been working on the workforce issue for more than 2 years. There are other issues that childcare needs assistance in, but this is the workforce strategy that we had looked at, what would work to keep people in the field and attract people to the field. We were tired of attracting them from other childcare agencies. We want to really attract people from outside the field into the field. So it is an attractive method for bringing people to work. I look at it as a small investment. $9 million doesn't sound like a lot when you consider the whole state and when you consider the numbers of people that would be accessing the benefits of this bill. No, it's time for us as a state to look at what this workforce behind the workforce needs. If we're truly interested in business, we're truly interested in helping business in this state. This is one of those things behind the scenes. Like we've learned with CELA that, your insurance cost and your trash removal cost can be, you can save money doing that if you do it as a group. This is where the state would come in as a group to help this industry. And it's not like any other industry. It's not like making widgets that you can just go buy some cheaper materials. We're dealing with children.
Okey doke. Thank you. All right. Yes, Senator Gray.
I do want to thank, all of the healthcare people, or childcare people out there. You do provide a service. We will continue to try to look for the right solution. I'm just not sure that this is the one. Thank you.
All right, let's, we still have 2 more bills I want to discuss. All right, let's, I think 450, Senator Sherman's working on an amendment, so we'll now get back down to the one last bill that we can discuss, which may be ready to go, maybe not, and that is Senate Bill 444.
Yep, so you have an amendment that was passed out last week. It's 0712. There are a lot of people working on this bill, a lot of people. This is, again, as a reminder, the early childhood part of the system of care. We have, the legislature, done a whole lot of work to build up the system of care. We need to make sure we are also supporting our very young children and those children subjected to significant trauma. Over the course of the pandemic, we've seen a horrific increase in child sex abuse. These children are in our schools right now, and we need to be able to provide them treatment so they can, grow and learn. So there's a lot of components of this bill, I understand, but it is one that many people have worked on and feel these are the missing pieces to the system of care. So I'm happy to take any questions about the amendment or go through the amendment line by line, whatever the committee
I don't think we need to go through any of the
Sure.
policy issues. I think that's been pretty well talked about for a long time. The big policy change that you have in your amendment is everywhere that the bill said children up to 8 years old has been moved down to 6.
That was, so we've gone back and forth. In the very first version of the bill, I had 6. The department asked me to put it back up to 8, and then they asked me to put it back down to 6.
Okay, all right. So that's that. The issue that I have with this bill, and I think that we all received an amendment from Ms. Ross that is on the funding provisions in the bill. I note, Senator Whitley, you took out there was a $550,000 appropriation that has been removed. But I think that, we heard testimony, and certainly it was, indicated, by Ms. Ross, that the other pieces, with the exception of the Family Resource Center piece, which is $1 million, which is, where is it?
Page
At the bottom of
4,
page 4,
10.
line 32. The other ones have already been funded
Yeah.
by ARPA,
It's,
so.
well, that's not true. So I have gone back and forth with Rebecca Ross on that. So if you look at line 21 on page 4, she had mistakenly asked me to take out that appropriation. Public Health at DHHS had asked me to put that in, so that's why that's still in there. And then if you look on the appropriation on line 13, when we went back and looked at the actual approval from GNC, it did not include this. So that has been clarified. That's why I've been working very closely with Rebecca on what has been covered and what has not been covered.
John, do you have anything to add?
I am receiving text messages, which is wonderful technology from Ms. Ross, and she has worked collaboratively with Senator Whitley. We do think that this is a much better version of the bill than introduced, and we want to thank her for her time. We do acknowledge that there are still some resource issues that are out there that we communicated with Senator Whitley around the bill, and hopefully we can keep working on those issues moving forward. Thank you.
So I'm not aware of, so what she had identified was maybe they need more staffing, which I'm fully happy to add. So I hadn't if the department wants to add more resources, I'm happy to do that. And I sort of asked for that also. Finance could also do that in the fiscal note. But I think my understanding was that the appropriations in the bill are fine, but that maybe the department would want to talk to financing about staffing. That's my understanding.
Well, let's go through them just to understand where they are.
Sure.
So the first one is on page 3 of the bill is introduced, $550,000, a one-year pilot program.
That's
That you
taken out.
dropped.
Yep, because
Okay.
that absolutely has gone through GNC and been approved.
So the second one is the child parent psychotherapy appropriation of $700K.
Yep.
Where is that? Has it been ARPA funded or not?
There has been, I can say my understanding, there has been ARPA funding for early childhood mental health, but not specifically to build the workforce for CPP. That there's already been significant philanthropic investment in this, in CPP. And so this is an already developed 5-year plan to build workforce capacity. And my understanding is that the GNC money does not cover this. It does support early childhood mental health, but it's not specifically for CPP workforce. It is ARPA money.
This is all ARPA money. Do you have anything to add?
I have nothing to add,
Nothing
Senator
to
Bradley.
add, all right. What about section 9, the appropriation of $500K for children's behavioral health care provider training?
That was requested by Abby Rogers.
Yes, that came from our Division of Public Health Services.
All right, so that has not been ARPA funded.
I would have to get back to you on
I
that
checked with
issue.
Abby and she said that it has not, that request is still necessary.
All
Then
right, I think we are fairly clear that the appropriation in your amendment on section 10 for the Family Resource Centers has not been ARPA funded.
Correct.
All right, so you can, I guess we can do two things. We can wait until next week and try to get clarification, or you can take your chances in finance if we exec this bill today.
And Senator
And
Bradley,
if we
the
did,
latter is
I would support an ought to pass, but understanding that they're gonna, want the answers to the questions I'm asking.
understood, Senator Bradley, and
And
we
I'm
would
not directing it to you, I'm more directing it to Senator.
I have
and
crossed
Senator
all my Ts and dotted my Is, Mr. Chair. I'm very clear what has been included and what hasn't been included. I
All
am.
right, John, you're off the hot seat.
Thank you.
All right, what does the committee want to do? automatically in 2 weeks or today? Today. Senator Gray?
If everyone else is ready today, I'll do it.
It's not gonna kill anybody to wait another week or two.
All right, let's get the answers then on, when we come back, John, in 2 weeks, we will have no hearings, so, oh, that's right, on Senator Gray's bill, all right. Hopefully, there will be no controversy about that.
Excellent bill.
Are you a co-sponsor?
I don't know, but I'm.
Oh, you're
fully
sure
in
it's
support.
excellent? Oh,
I'm
okay.
sure it's excellent.
All right, well, it's a result of a study committee, it was a unanimous recommendation.
Yeah, it's a good.
So,
Am I co-sponsor?
I believe you are.
John, just if you can make sure that the appropriate people are here to answer the questions that we have.
I will.
Okay, all in favor, say aye. Aye. We're done. Thank you all very much. We'll see you on, I think it's March 8th, 9th.